next one, and luckily you guys, we've actually already talked about Candida albicans. Some studies suggest up to 50% of us are colonized with low numbers of Candida albicans. I find it hard to believe that we all are colonized with at least a few Candida albicans. That's just my own thought. But what we want to recognize is that Candida albicans is an opportunistic pathogen. In people with normal immune systems or where physiologically everything is working fine, usually Candida albicans never grow to really high levels. So we can be colonized without them causing harm. Again, if we have any lowering of our normal defenses, that's usually when Candida can start multiplying to high levels. Often it's causes secondary infections following broad-spectrum antibiotic use, say for bacterial infection. The doctor would give us broad-spectrum antibiotics. You kill all your good bacteria, like your good lactic acid bacteria, that help to inhibit the growth of Candida. Since Candida is a fungus, the antibiotics don't kill it. So you end up killing its competitors, and that permits Candida albicans to grow to really high numbers. Now, classic infections with Candida, we can get infections of the mouth, oropharyngeal candidiasis, which is called what? Thrush, right? Okay. And it will usually present as a creamy, thick, white, yellowish coating of the tongue and perhaps the back of the mouth. Okay. And then in women, unfortunately, Candida can cause overgrowth on the vaginal mucosa. So that's the classic vaginal yeast infection. Again, frequently follows broad-spectrum antibiotic use. Excuse me, in people of all ages, you can have horrible anal rectal Candida infections, which is really tough, especially if you're a pilot, going on these long flights, you know, you got this Candida infection in the anal rectal. Not fun at all, not fun at all. Okay, so you all want to remember in your microscope slides, you saw Candida as a budding yeast. So classically, that's how it would present. Like if you had, say, a little baby, maybe present with this thick white coat on the tongue, you could just take a little cotton swab and sample that coat, make a smear of it, and gram stain it, and look for budding yeast. And if you see budding yeast, you know that's a pretty good indication that this could be candidiasis. Yeah. Okay. So that's our opportunistic. I classify this guy, normally it causes infections of mucous membranes, but in folks that are severely immunocompromised, it can invade deeper and cause systemic-wide infections in folks that are severely immunocompromised. So that's something you want to be aware of. Candida can cause invasive disease as well. Okay. Let me just put a couple of high-risk groups. We want to recognize that many of these fungal pathogens, they really are opportunistic pathogens. They usually don't cause harm in folks that have normal immune system. So our high-risk groups, we always worry about, the really young, the really old, because their immune systems aren't functioning 100%. Folks that are on, that are being treated for cancer, so are on chemotherapy, radiation therapy, their defenses are lowered. Folks that are on long-term steroid therapy for chronic inflammatory disease, transplant recipients that are on lifelong immunosuppressive therapy, and then one that I keep forgetting, and I just wanted to bring this up. So folks that have diabetes are also at high risk, and it's because if the diabetes is uncontrolled and they develop ketoacidosis, the ketoacidosis inhibits phagocytosis. So it would inhibit the phagocytic killing by neutrophils, inhibits phagocytosis. Okay, so that's going to decrease the function of their neutrophils and put them at much higher risk for fungal infections. And then another one, oh, it just skipped my mind. Doggone it. My brain, like a fifth. Don't get old, you guys. Getting old is no fun. There's another really important one that I just spaced out on. Doggone it. Okay, we'll come back to it. There's another high-risk group. I go, I need to tell them about that. Okay. Okay. All right, so our superficial fungal pathogens. And now what we're going to close with you guys is just three what I'm going to call systemic fungal pathogens. These are ones that aren't content just to live on our surfaces. They're going to invade deeper. And usually the way we get infected is we inhale their spores from the environment. So usually they initially cause what kind of infection? Respiratory infection, right? And if we're lucky, if our immune system is working well, usually our immune system will contain them, so they only will cause a lung infection. But again, in the immunocompromised, they often can spread. And we'll talk about how some of these guys, they'll spread to skin, to bone, and really tragically, they spread to the central nervous system. And they can cause life-threatening infections in folks that are immunocompromised. Okay, so we're just gonna talk about 3 of them. And again, you guys, I'll put some details up. Don't panic though, because the details are all over there on the fungal symbiosis spreadsheet, I guess we could call it. So let's see here. Let me put this up here. Okay, so these are the systemic mycoses. And again, folks, this is just a few. But some that I think are important, especially here in California. Okay. So we'll first start with Coccidioides Immitis. And this fungus, key point here, so we'll put a star by it, it's a dimorphic fungus. And dimorphic means 2 forms. So most dimorphic fungi, they grow as molds. So filamentous molds in the environment, so in dead, decaying organic matter, they grow as filamentous molds, okay? And then once they infect us, once they infect animals, they switch over to a unicellular form. And I'll put unicellular yeast-like form in humans. So just to try to complete how we get infected, when Coccidioides Immitis is growing in the dirt, the soil, growing on dead, decaying organic matter, it'll form filaments, right? But what it'll do is, when it's ready to reproduce asexually, it will form a special little spore in the hyphae called an arthrospore. It literally means jointed spore. In your textbook, they use the term arthroconidia, but I'm just going to use the word name arthrospores. And they form in the hyphae themselves. So what would happen is, if you, say, live down in the Fresno area, because the Fresno area is a hotbed for Coccidioides Immitis, if you're out working in your yard, gardening, and you're digging up the soil, the hyphae will break apart, and these arthrospores become aerosolized. They're aerosolized, and then we breathe them in. And they're so tiny, they can escape the normal defenses of the upper respiratory tract. They escape the mucociliary escalator, and they make it down into our lungs. And there, the arthrospores, they mature into, and this terminology you guys don't need to worry about. Arthrospores, they're going to mature into this spore-producing structure called a spirule. And again, this is terminology you don't need to know, but when you're looking at the natural history, you'll have an idea of what they're talking about. And within the spirule, this would be in your lungs. The spirule starts making these little unicellular yeast-like forms. Now, and what's troubling you guys, I wish they had named these unicellular forms as, they call them endospores, and I just wish they hadn't done that, because I'd like us to think of endospores like being produced by Bacillus anthracis, okay? But the medical books all call these unicellular, one-cell, yeast-like cells, they call them endospores. So I guess we better call them endospores too. But what I want you to understand is they look like the unicellular yeast form of fungi. So we'll call them unicellular yeast-like endospores. And what happens is, in our lungs, when these spirules mature, they break open and release the yeast-like endospores, and they spread throughout our lungs. And if we're unfortunate, they can spread through the body to skin, bone, and brain, right? Now, usually you won't have disseminated, means spread, spreading infections, but you're at high risk if you're immunocompromised. So immunocompromised are at high risk, so increased risk for what's called disseminated disease. That's when it spreads from the lungs throughout the body. Now, why is this of concern? Well, it turns out there's actually a little epidemic of Coccidioides Immitis infections. The common name for these infections, because they're so common in the San Joaquin Valley, it's called San Joaquin Valley fever, or just valley fever. So this, here we are, here in California, another hot spot for some of these unusual diseases, okay, often referred to as valley fever. So one of the really unfortunate things going on right now down in the Fresno area, some of the prisons are expanding. So they got all this construction going on, and that's another way for the arthrospores to be disturbed in the soil. If you have construction, big tractors, heavy machinery coming in, digging up the soil. So these prisons are expanding. They've got all this construction work going on, and they are causing the air to be filled with these arthrospores. And a lot of the prisoners are suffering from HIV/AIDS infections. So they're having this outbreak of valley fever in their severely immunocompromised prisoners. And oh my gosh, you guys, that makes it so hard. Here you have a eukaryotic pathogen invading a eukaryotic host whose defenses don't work anymore. So these are really tough infections to deal with. And in general, you guys, you should be careful. Whenever there's construction going around immunocompromised patients, you have to be concerned. One of your colleagues said over at the UCD Med Center Shriners Hospital, they have construction going on there, and they've seen a spike in fungal infection in their burn patients. And they think it's because the fungal spores are getting aerosolized by all the construction work, and the air intakes of the hospitals are sucking in all these spores. They aren't getting filtered out, and then their burn patients are getting infected. So it's just something to think about when there's construction going around. It's like, okay, gotta be extra careful. Okay, so key points, you guys. Coccidioides Immitis causes which disease here in California? Valley fever, right? We say Coccidioides Immitis is a dimorphic fungus. What does that mean? It can grow as a filamentous mold, and it can also grow as a yeast-like unicellular organism, right? How does it grow in the environment? Is a filamentous mold. How do we get infected? How do we get infected? We inhale what? Arthrospores. Good, okay. And then when we inhale the arthrospores, what's going to happen in our lungs? We get the switch to growth at this yeast-like stage, right? Okay, and these yeast-like endospores can break out and spread throughout the body potentially to other parts of the lung. Where else can they spread, you guys? Skin, bone, and CNS. Good. Okay. Very good. All right. That is that. Oh, one last thing. Probably, I bet you the majority of us have already been infected with Coccidioides Immitis. Often the infections will be asymptomatic, or maybe you think like you have the flu, right? But your immune system takes care of them. But probably, I am willing to bet a lot of us have little healed valley fever lesions on our lungs, right? Now, the reason that's important is on a radiograph, that healed lesion can look like what? Lung cancer, right? And so there have been stories where people have had like lung lobes removed because the doctors thought they had lung cancer. It turned out to be one of these healed valley fever lesions. So make sure if in the future you guys ever have abnormal chest radiographs, remind the physicians that you were probably exposed to Coccidioides Immitis, and remind them it's very important that they keep healed valley fever lesions in mind with the differential. That becomes really important if you move out of California. Hopefully here in the valley, the doctors would know that, but if you move back east or some other part of the United States, they might not have that on their differential diagnosis. Okay, so you don't want to have your lung lobes removed unnecessarily. Okay. All right, Cryptococcus Neoformans, again, this is one that we had mentioned briefly. Another systemic pathogen, and historically, we usually thought of Cryptococcus neoformans as being another, opportunistic pathogen. A risk factor for Cryptococcus infections, okay, being immunocompromised, definitely. But then another factor that you guys want to remember is that Cryptococcus immunocompromised, Cryptococcus neoformans apparently grows really well in soil that's been enriched with bird feces. Yeah, apparently the extra nitrogen in there causes Cryptococcus neoformans to grow to really high levels. Okay, so risk factors would be immunocompromised, and this another really important risk factor for you to let your immunocompromised patients to know is in soil enriched with bird feces. So in cities, pigeons are a huge concern. A lot of hospitals go to a lot of effort to try to prevent pigeons from roosting around the air intake vents, because again, the pigeon feces, itself can have Cryptococcus neoformans in it. It's not because the pigeons are infected, but they think it's because pigeons, they peck in dirt, right? And so if the pigeons are foraging for food in dirt that has Cryptococcus neoformans growing in it, then they're ingesting it and it comes out in their poop. And then if there's pigeon poop and dirt, because the Cryptococcus is in the dirt, then the Cryptococcus is going to grow to really, really high levels. Okay, so if you have immunocompromised patients, like one of the things you'd say is you wouldn't want to take up pigeon raising as a hobby, right? That would not be a good thing to do if you're immunocompromised, right? Because there is Cryptococcus neoformans. Okay, now one of the things you want to recognize in looking at some of the photomicrographs of Cryptococcus, it's an unusual fungus, an unusual yeast, because it has a very thick capsule. It's, oh my gosh, some of the photos that you'll see on B12, you'll see this little tiny yeast cell right there, surrounded by one of the thickest capsules I've ever seen anywhere. Okay, so here's the little yeast cell right in the middle. What's this structure on the outside again?
It's a capsule.
It's a capsule, right? Now, with pathogens, why is synthesis of a capsule protective? Why would that be good if you were a pathogen that wants to invade a human? What does that capsule inhibit?
Will not be destroyed by any antibiotics.
Okay, I mean, that was a good one. Francis, you nailed it, okay? We want to remember those capsules are what? Anti-phagocytic, they inhibit phagocytosis, right? Because our phagocytic cells, they don't have any receptors to attach to capsules, okay? So the capsule inhibits phagocytosis. Now, what did we say is one of the most important defenses against fungal infections, you guys? What did we say was like the most important protection against fungal infections is? Neutral phagocytosis. Yeah, just phagocytosis in general. So we can see how this Cryptococcus neoformans, if we inhale it and it starts to grow in the lungs, it makes this incredibly thick capsule. Our phagocytic cells can't phagocytize it, they can't destroy it, and hence it has great potential to spread throughout the body. All right, now again, especially in immunocompromised, our concern has grown because we now have a new species, Cryptococcus. We have a new species of Cryptococcus called Cryptococcus gattii that we think was introduced from Australia to the west coast of Canada, possibly in eucalyptus trees. It seems to be associated with plants, tropical plants. And this one is scary because it is causing severe infections in poop. In the immunocompetent, what does immunocompetent mean? If you're competent at your job, what does that mean? If you're competent at your job, does that mean you're bad at your job or good at your job? You're good, right? So immunocompetent are people that have what? Bad immune systems or good immune systems?
Good immune system.
Healthy, normal immune systems, right? So this new species of Cryptococcus gattii is causing severe infections in folks who aren't immunocompromised, of huge concern. And I did do my homework. I was gonna check to see if we have, it started in the west coast of Canada, it moved to Washington, Oregon, and I did do my homework. I didn't see if we've had cases here in Northern California, but my guess is it's coming, right? So we need to be aware of this, that this could be another fungal infection of your immunocompetent patients in the future. Almost finished, you guys. I know you're just tired out here. Okay, big breath here. All right. The last systemic fungus that I think it would be important for you all to know about is called Pneumocystis. I'll give you the old name first, and then I'll give you the new name, Pneumocystis. The old name was called Pneumocystis carinii. Okay, and Pneumocystis carinii became tragically famous starting in the 80s. Because it's almost, I shouldn't say it's 100% signalment of AIDS, but if you have a patient develop Pneumocystis carinii pneumonia, so lung infection, called PCP, there's a very good chance your patient may have HIV/AIDS. I mean, they've progressed to severe immunodeficiency. So, you know, whenever a patient presents with PCP, you want to check and see, oh my gosh, you know, could this be HIV progressed to AIDS? Or some other condition that has really, really suppressed their immune system. My guess would be probably most of us already carry PCP, or excuse me, most of us already carry pneumocystis, but it's such a low virulence pathogen, it doesn't cause disease in folks with normal immune systems. Our immune system will keep it under control. It's only when the immune system collapses that it can start replicating and causing serious respiratory disease. It can kill. Now, why did I say this is the old name? There's another thing that frustrates us in mycology, right? They're always changing names. So the new name now, why do they do this? I do not know, you guys. It makes me crazy too. The new name, it's still called Pneumocystis, but they've changed the specific epithet to Girovicii. Okay, but they still call the pneumonia it causes, they still call it PCP pneumonia. Okay, just in the hospital, so you guys will know. So again, the significance here is that if you have a patient with PCP, you must look for an underlying immune disorder. Healthy people don't get PCP. Only folks whose immune systems are crashing are going to get PCP. Okay? All right. The last little topic, you guys, was just fungal toxins. Okay. These are fungal diseases that are not caused by the fungi growing on us or in us. It's caused by the ingestion, eating fungal toxins. And here's a vocabulary word you do want to know. Fungal toxins are called what?
Mycotoxins.
Mycotoxins. The two mycotoxins I'd like you guys to know for the lab practical is one we've already discussed, the mycotoxin produced by Claviceps purpurea. And what was the name of that toxin, you guys?
Ergot.
Ergotamine, right? And we said that Claviceps purpurea likes to grow on wet, moist grain, right? And we have this cool example of Claviceps purpurea. It's growing on the heads of grain. It's replaced the grain by all these collection of hyphae. This is called the ergot. What is inside the ergot? What toxin is present?
Ergotamine.
Ergotamine, right? So if we harvest the grain, we grind it up, we make flour out of it, the ergotamine is present, it's heat stable. We ingest the ergotamine containing flour. And why might we go on some hallucinogenic trip?
It's the same structure as LSD.
Because it's so similar in chemical structure to LSD, right? So it causes hallucinations, it causes vasoconstriction of our blood vessels in the periphery. We cut off blood flow to fingers to toes. We get necrosis, right? Might also cause a burning sensation, hence St. Anthony's fire. It also causes smooth muscle contraction of what in pregnant women? The uterus, right? So you get spontaneous abortion. So, you know, nasty things. Somebody was saying, oh, I want to try some of that. I say, no, you don't. You do not want to try some of it. It's not good. Do you remember, you guys, that you wanted to look at the longitudinal section through the perithecal heads? The perithecal heads are going to grow from the ergot. And let me go get that cross section really quickly, you guys. structures in which the asci, the little sacs, are gonna be formed. And you guys remember this section? The little asci are the little filaments in these, what are called perithecia. And inside the asci are the sexual spores called what?
Ascospores.
Ascospores, right? So claviceps is what? A zygomycete, basidiomycete, or ascomycete? Very good, you guys.
Ascomycete.
Good. Okay, so that's one of the toxins. And then the other toxin that again I thought it was important for you guys to know about, it's called aflatoxin. And this is a toxin made by another fungus called Aspergillus. Aspergillus will commonly grow on moldy peanuts. And when they grow on the moldy peanuts, they produce aflatoxin. In laboratory animals, aflatoxin greatly increases the risk for cancer, like liver cancer. And so the concern is, what if there was an unethical peanut farmer who had a batch of moldy peanuts, and instead of throwing them out, what are we worried he or she might do with those moldy peanuts? Might make them into peanut butter, right? And who eats a lot of peanut butter? Kids, right? And kids are very, very sensitive to toxins of any kind, right? So this is a huge concern. We want to make sure that, we don't want people consuming aflatoxin, and especially we don't want children consuming aflatoxin. Now, here in the United States, we have assays, that are done on peanut butter, but there is concern in areas of the tropics where, food products in general, because it's so warm and moist, food products have, high risk of becoming moldy. In tropical warm areas where a lot of peanuts are consumed, this is a huge concern because I shouldn't say very often, but there's a higher risk of aflatoxin poisoning from those moldy peanuts. Okay, so just another example of a mycotoxin that's associated with food products. Okay, so you guys, I know that was a long introduction there, but it does finish up our part 2 of fungi. As I mentioned, you guys, on the white poster over there, I tried to include all the key tidbits for all the fungi that we discussed. And again, we've got the lichen